Hi, so this is an assessment of an adult patient. We're gonna first start doing the assessment of the head, eyes, ears, neck, and throat. So normally, if this is the doctor's office, the patient comes in and I'm assessing them. I'm gonna start by asking their past medical history. Uh, so when we start from the head, we would ask them by first asking them if they've had any childhood illnesses, such as any congenital deformities, seizures, meningitis, and the adult patient will be able to answer all those questions. Have any history, any surgeries they've had, any scars I would expect. If they've had any surgery. So we would start by collecting subjective data, but just to save time, we're gonna videotape only the assessment portion. So for the head, eye, ear, neck, and throat, we're gonna start the assessment by just looking, by inspecting. We always start the assessment by first inspecting. And so we're gonna look at the head. It should be a normal size. Now for adults, we don't measure the head. They've already reached their maximum growth. And so it should just be a normal size. It should be sitting right in the middle, so there should be midline. It should be rounded. If they're wearing a hat or a wig or anything, we can ask them to remove it. My mom didn't comb her hair, so she doesn't want to remove her hat, but we'll pretend it's off. And so later on when we do the palpation, we're gonna feel for the cranium for any bumps or any mass, any tenderness, which would be an abnormal finding. So we're assessing the head for symmetry, for making sure it's in the midline. There is no obvious swelling, any obvious deformity. The next thing we're gonna do is just look at the face, make sure everything looks normal, the color looks good. The nose is right at the midline, the lips should be midline, the mouth should be midline. If the patient's communicating, there should be symmetry. If she's smiling, everything should be symmetrical, the left and the right side. The eyes should be positioned at an equal horizontal. One shouldn't be up and the other shouldn't be down. There shouldn't be any redness, significant redness, any puffiness or swelling. Necessarily, it's not a bad thing, but maybe there's a lack of sleep or they ate a lot of salt to cause the edema. But we'll just look at also the color of the lips. It should match. It should be, pink and not blue or purple. Also, we look at the ears, make sure they are sitting lateral side of the head and that they are equal in position. So we would be finished with the inspection. At this point, I would get up and I'm going to just start feeling for the cranium and just kind of palpate it, make sure it's nice and smooth, and let me know if anything is tender or sore. Okay? We can also touch the ears while we're here, check behind the ears. We can also do the lymphatic system. We can check the lymph nodes, the mastoid. Can you open your mouth and close? Okay. We could check the temporal artery pulse here. It's not always palpable, but sometimes it could be.